Hi all, today we are here to discuss a new topic. What data and experts say about how Kerala is efficiently handling the COVID outbreak. Kerala, the God's own country, spread over 15,000 square miles, is one of the smallest state in India. It is small and densely populated, but relatively well-off state. Kerala is one of India's progressive states in terms of social welfare and quality of life. The state boasts of one of India's highest literacy rates, highest life expectancy and lowest child mortality rates. The literacy rate for women in Kerala is one of the highest in all of Asia. Flanked by the Arabian Sea in the west, the towering Western Ghats in the east and networked by 44 interconnected rivers, Kerala is blessed with a unique set of geographical features that have made it one of the most sought-after tourist destinations in Asia. Recently, Kerala has now been praised both internally and internationally for its efforts at curbing COVID-19 outbreak. By adopting a highly proactive approach in fighting COVID-19, Kerala is indeed setting an example for other regions not only in India but across the world. The state faced a potentially disastrous challenge: a disproportionately high number of foreign tourists' arrivals. 1/6 of its 33 million citizens are expatriates, and thousands of its students study in China. This made the task more challenging. The success mantra is simple: they follow the WHO model stringently. With the help of Kerala's people, doctors, police, government, and media, plans for containing the spread were implemented in the state effectively. Let's understand how a small state could flatten the curve first in the country. 1. Early efforts. The state was ready before. When many states and countries evaluating the situation and formulating the plan, Kerala was prepared for fighting the COVID-19. In 2018, the state had dealt with an outbreak of Nipah, a brain-damaging virus that had originated in bats and transferred to humans. There was no vaccine and no cure. 17 people had died. The Nipah virus outbreak provided a shot in the arm, and the state ramped up its healthcare facilities even further by putting together an integrated surveillance, diagnosis and prevention mechanism. This helped a lot in preparing and fighting the COVID-19. In India, the first case of COVID-19 positive was identified in Kerala, who was a student of Wuhan University. The state declared it a state calamity just after 2 cases were tested positive. The people were educated and isolation wards were installed in all government medical colleges across the state as precautionary measures in January. These measures showcase the state's ability to control such situations quite efficiently. Early order of lockdown, shutting schools, banning large gatherings, and advising against visiting places of worship helped to contain the spread. The first 3 coronavirus cases in India were reported from Kerala earlier this year, which according to experts is a sign of their efficient and proactive surveillance system. 2. Flawless tracing. They followed a WHO-recommended plan of contact tracing, isolation, and surveillance. The plan relied on consulting patients, mapping their movements and isolating anyone in the chain with symptoms. This was the only option to break the chain. In each of the 14 districts of Kerala, special cells have been formed to prepare route maps of each infected person. The team relied on old-style detective work and technology to trace the people. By using GPS data mined from the positive cases' mobile phones, surveillance footage, data provided by the patients and near-kins, the team retraced their paths. The information comprising the place and time is then circulated through newspapers and social media with the request to all those who came in contact with the person in those places to be vigilant and access preventive care. 3. The people. Kerala has the highest Human Development Index in India. Kerala has the highest life expectancy, per capita income, literacy rate, and sex ratio in India. It has a 94% literacy rate, the highest in India. In Kerala, most people realize the seriousness of the situation. Everyone around knew the number to call if they developed symptoms, and they weren't acting heedlessly by rushing to the hospital at the first sign of a dry cough. The people supported the government and police in effective enforcement and implementation of the social distancing, lockdown and sanitary precautionary measures. Without people's support, no state can win this battle. 4. Improved health infrastructure. Undoubtedly, being the most literate state in the country, the governance for decades prioritizes the utmost importance to human security and social welfare. For the last 15 years, irrespective of the political parties, the government of the state has invested heavily in public education and universal health care. Kerala has accelerated its efforts to strengthen primary health care. Over time, these changes have built a strong healthcare foundation and network at the local level across the state. Kerala has the best performing public health system in the country. It tops India's rankings on neonatal mortality, birth immunizations and the availability of specialists at primary care facilities. According to a study, state has the best provision of palliative care for patients with serious illnesses in India. Given that health security is an important component of national security, the case of Kerala's health infrastructure in curbing diseases even in the past is a motivation for the nation as well. The state took the lead in deploying rapid testing kits, which officials say they continue to use in hotspots to check community spread. This week, Kerala began walk-in testing facilities, which reduced the need for protective gears for health workers. 5. State support. While the rest of India, along with countries, wouldn't take stringent steps to limit movement for another 2 months, the state government enforced strict actions at a very early stage in the state. The government ensured all machinery of the entire state was at the special team's disposal. The announces an economic package worth $2.6 billion to fight the pandemic days before the central government's lockdown. This helped the people to meet the need during the lockdown and helped people support the government. Some initiatives worth mentioning are Community Kitchen to feed the public free. They are now cooking and distributing 2.5 to 2.8 lakh of free food packets a day. Free provisions including rice, oil, and spices to all families with help of central public distribution shops to 35 million cardholders. Stepped up production of hand sanitizers and face masks. Begun providing nutrients for midday meals to 3.75 lakh children at home. The midday meal scheme is a school meal program of the Government of India designed to better the nutritional standing of school-aged children nationwide. Boosted internet facility for work from home. Set up mental health helpline. Moved up the date of state pension payments. These actions assuaged the public's fears and built trust. The vast network of Kudumbashree's presence has enabled a strong sense of citizen-centric governance and community-based action at the local level. 6. Central lockdown. Prime Minister of India Mr. Narendra Modi declared that India would go into a 21-day lockdown. Even though Kerala government started restrictive measures days before the lockdown, the national close-down gave Kerala government an added advantage. The public distribution system and $22.6 billion relief packages to all the states gave Kerala more power to fight. 7. The government officials. The coordination and control of the administrative officers are extraordinary. They lead the task force to the efficient works. Appreciation has to be given to the brave doctors and nurses. The Kerala Police's efforts are also applaudable in maintaining strict lockdown. The efforts of health workers and ASHA workers also helped the government. 8. The media. The state has the highest media exposure in India with newspapers. The media also shares the facts and thereby creating a rich source of content for people to reflect upon. 9. Future community screening to begin soon. As we are entering the third stage of the virus spread, the state government is in the process of starting community screening, which is random testing of persons who are not in the zone or risk or have traveled abroad or been in touch with such individuals. The Sentinel surveillance centers, besides testing people in the community, will be responsible for analyzing collected data to check any increase or decrease in COVID-19 cases. Now the infection curve may be flattening, with not many new infections being reported in the past week. The recovery rate is more than the infection rate. This state has achieved it through a relatively high number of testing, effective scrutiny and surveillance. Please subscribe and support.